All right, so now we're going to try the pretty much exact opposite parameters of what we did before on the previous video. We're going to try to get some increased cellular metabolism, maybe some increased membrane permeability to get some inflammation out of some of this deeper tissue in the lower back. You know, it could be effective for somebody who's maybe recently had a microdiscectomy or something like that, where there's a lot of scar tissue. It may even be adhering to those spinous processes, something like that. And when you're ultrasounding the lower back, just remember your anatomy. As we're applying the ultrasound, as you come over here towards midline, remember that those spinous processes are a lot more superficial than this than the multifidus muscle, the things you're trying to heat up over here, or those deeper tendons. So if you are crossing the spine at all, make sure you're spending less time over those bones so we don't get that periosteal pain or that periosteal heating of the ultrasound that's being reflected. So coming over here to the unit, since we're going for that deeper tissue, we're going to change our frequency to 1 megahertz and of course go up to 8 minutes. Since we're going for this non-thermal effect, we're going to change the duty cycle to 20%. As I mentioned earlier on the other video, 20% has been the most researched as far as pulsatile ultrasound goes, or non-thermal ultrasound goes. So with the frequency being lower and that wavelength being longer, that leads to deeper penetration, but it also leads to less generalized heating. So we're going to increase that power by a little bit in the lower back so that we get a similar effect. Now, if we were doing this continuous, we would want it a higher power to get a similar heating as we would with a 3 megahertz setting. So again, I'm going to place the ultrasound on her lower back, the transducer on her lower back, and hit start on my unit. And then as we go here, remember I'm putting 1 to 5 pounds of pressure through this the transducer or the ultrasound head. And notice, see if I'm just kind of holding it by the end and moving that around, there's a little gap as compared to if I'm actually giving it a little bit of pressure. So this increased amount of pressure gives that, not only does it give a better massage, but it also helps with the transmission of that ultrasound. We don't have any gaps or any air that's gonna decrease the intensity of the ultrasound as we perform it here. So as I mentioned, we wanna keep it to about anywhere between 2 and 4 times the effective radiating area. Since I'm doing a bigger area, I have a higher intensity, I'm going to do closer to 3 to 4 times that effective radiating area of the ultrasound head. But same thing, we are making little concentric circles. Now the research says speed doesn't necessarily matter. These ultrasound waves are going in relatively quickly. It's more relaxing to the patient though if you are going at a slower speed. And don't feel like you need to go in just this counterclockwise circle the entire time. You can, there's an alternate technique as well. If you don't like doing those little circles, you can also just slowly move in a wave form. But typically, the concentric circles or the overlapping circles is the preferred method of ultrasound delivery. So that's it for this one.